Let's get started.
Yeah.
So we'll do a little quick introduction first, and then we'll jump right into some fun mental health crisis management and how we bridge mental health and crisis supports, at home and within the community. So my name is MaryAnn Emerick. I am a social worker. I am senior manager of youth and community services at the Huntington's Disease Society of America. I've been there for about 6 years. So some of the stuff that I do is I answer the national helpline. So I get a lot of these calls from all over the country. The other thing I do is I run support groups, manage all the online support groups around the country. And then my favorite part of my job is educating social workers and professionals around the country and managing all the youth and young adult programs nationally. So that's like a quick what I do at HDSA. I've been part of the community my whole life. My mom passed away when I was 20 years old from Huntington's disease. And after that, I was like, I'm gonna find a cure. And then I had to dissect a cat. And then I was like, I'm gonna be a social worker. That's better. And I'm like, how can I help? And who helped me growing up, right? And like really wanting to be that person. So was really lucky. I got a position at the same facility my mom was a patient at, which had an HD unit. And here I am today. I'm really, really lucky and grateful. This is like my 6th education day in North Carolina, so I'm lucky to call this also like my home. So.
All right. I'm not as interested.
No, okay,
interesting
that's
as
not
MaryAnn. I'm Latorius Adams. I'm a case manager at UNC Chapel Hill Neurology. So I work in our Huntington's disease clinic and our ataxia clinic. I've been there about 4 years, but I have over 10 years experience working with family caregivers with Alzheimer's and dementia. So I'm happy to be here, help, connect, talk, do anything that is needed to help my patients.
Perfect. And I first want to just start with like this conversation. We're not going to all of a sudden, like I'm going to switch the slide and it's going to be like, these are the answers, right? I wish we had that, right? Every situation is so different. So many people are like, oh, if you just plan, if you just do this, like everything's going to work out. That's not the case.
Right.
You could be the biggest planner in the world. You could have everything set and things that are unexpected happen all the time.
Right.
Or just like your loved one or yourself is just going to respond or react in a different way than you expected. And then you also have the healthcare side of it and medical side of it that don't necessarily, you can't rely on them until you're in that crisis moment. Imagine we had services that we could put into place beforehand so we didn't get there. So anyways, I don't want you to think you're going to get the answers. We're hoping just to build up your toolbox today, really. Okay? So, and please, like we said before, be interactive. Ask us questions. Be like, stop, you don't make sense. So some of the things we're going to talk about, we're going to understand what a crisis is in HD and JHD, planning for a crisis, learning crisis responses, de-escalation strategies, finding support and resources, and building confidence in a crisis response situation. So crisis situations. So these are like, what are the different types of crises that could happen, right, with your loved one? And it could just be one of them, or it could be all of them happening, or it could be 2 of them. And sometimes we don't expect, we plan for one, but not the other, or not both, right? And that just becomes a little bit more complex. So emotional, those are things like depression, anxiety, suicidality, feeling hopelessness, and that's something that happens. That's a chemical imbalance in the brain. That is out of your loved one's control. That's out of your control. As someone that deals a lot with, we talk about like mental health and mental illness, and somebody that suffers, or not, I don't want to say suffers, lives with, and try my best. When I'm in my crisis situations, people are just like, just think differently, and you're like, I'm sorry, I can't. My brain is telling me not to, right? So it's just figuring out how to deal with it in that moment instead of trying to change how you feel or how you're perceiving the situation. Some behavioral things are like aggression, impulsivity, and being unsafe. The most important thing when you're at home with a loved one or even out with loved ones, it's making sure you're in a safe environment, right? And a lot of times behaviors can make things unsafe, whether that's like that reaction or response to something. So with HD, you might think of like a feeling or emotion that comes up, and it's like frustration. I'm frustrated because, like we said, Teepa earlier cued it up perfectly for us, like that part of the brain that just can't like figure out what word or how am I going to react to this situation. And all of a sudden it's like, I'm mad because I just want to drink and I can't get the specific drink I want, but my reaction to it is to explode and flip out and flip the chair over, right? And it's like, that's not the right response to that, but somebody like that, what's going on in the brain, they don't know that, right? It's just like, I'm frustrated, I'm angry, and this is how I'm gonna respond. Just an example, and I'm sorry if I talk, so please tell me to shut up. But my uncle, he was a big smoker. And so when he was at the nursing home, which I got to work at the nursing home while he was there, he was fixated on like times and fixated on the schedule of smoking. And so if it was like 1:02 and he was supposed to go at 1 o'clock, I got punched in the face. He loves me to death. Right after he'd be like, I love you. And I'm like, I know, it is what it is. And, but that was his reaction because he was mad and he couldn't explain why he was mad. So that's something that like just happens a lot. And then some cognitive issues that happen, confusion, disorientation, a lot of paranoia, and like fixations on things, right? So being paranoid, my mom was paranoid that people were trying to take me and my sister away from her. So she would call the cops every single day. We were at school and she's like, they're trying to take them. So a lot of that like cognitive impairment comes into play with like understanding like the reality of the situation. It's really important, and we'll get into like de-escalation techniques and like what triggers are. But a lot of times it's remembering that you're not trying to change the person's reality. They're perceiving the situation the way they're perceiving it. So how do you calm them down rather than, that's not what's happening right now, but in their mind, that's what's happening, right? So why change that? And then really important that not talked about, but caregiver crisis, that's burnout, feeling overwhelmed. So imagine your loved one is becoming aggressive or, is emotionally unstable, and then you're just like overwhelmed and you're crying because you're just like, I can't deal with this right now. And that's where we talk about all the time, like finding that support prior to building your resource team, building your care team, so it's not just you. You have to, cliche, you can't pour from an empty cup, but it's so true, you really can't. So making sure you're taking care of yourself. And I do know that that's not always possible, right? So it's like finding that 2 minutes in the beginning of the day to do something to fill your cup. Or just like, what am I gonna need today? Where am I at right now? But it is hard. Sometimes we don't have that option as caregivers. So why HD crises are unique. So like I said before, it's not just one, right? It's not just one crisis situation. It's not somebody in like a psychosis, maybe somebody that has bipolar or schizophrenia in a like manic state. It's that happening with also like the cognitive impairment that like doesn't understand the reality of the situation or what's going on in the real world, I'm gonna say, but in their head, something else is happening and maybe their reaction or response is different. So that's where that like why it's so unique and different. And I don't know if anybody's experienced this, but sometimes you'll call maybe emergency services and all of a sudden the crisis is no longer happening when they get there. And you're like, I swear, they threw me through the wall. Like, or they were having, and so oftentimes when emergency services come, they're there to help immediately. And if there's nothing happening, they can't do anything. And a lot of times, like this is something that happens with people with HD and not always with other, different mental illnesses because there's usually like a more lengthier process to that. But so that's where it's pretty unique. Anything else that?
Can I ask a question?
Yeah.
What is the brain chemistry that causes that quick flash of anger and then quick flash of not anger anymore?
It's a great question.
Maybe there's no answer.
And I don't, not that I don't know like what chemistry it is, but it's really just like the response of like, so when we think of, executive functioning of the brain, right? Like knowing like the process of like, okay, so this is how I'm gonna go and create the solution to this problem, right? There's missing pieces of that, right? And so something that's super complex or isn't that complex to us, right? Like that are just thinking about a situation, like what's the big deal? Just go and grab the drink you want. There's something missing, right? Like step 2, even though there's 3 steps, step 2 is missing. So it's automatically like, let me get frustrated. And it could be something that, is building up, right? And it's not just that immediate like situation that happens. So let's say, I have Huntington's disease and I can't like physically pull up my sock, right? And it's just in my sneaker and it's so freaking annoying. And then all of a sudden, my sister's bothering me, my dad's bothering me about something. And then all of a sudden, they bring me mac and cheese and they know I can't eat cheese. And I'm just like, I'm done. I'm like at my limit. Like it was just that little thing that just tipped me off, right? And often, I don't know if anybody's experienced this, but I've been fetal position, crying hysterical about a spilled cup of coffee, but not all the craziness that's happening in my life, right? But that cup of coffee was what like tipped me over, right? So a lot of times that's it too, and we just don't even realize it because we can't communicate that. Does that make sense?
It does, and I've seen both in my brother-in-law and my wife, that they'll have these quick explosions.
Mm-hmm.
Really, really mad at me, or
Mm-hmm.
a lot of times me because I'm throwing these around. But it'll blow over very quickly. It's like they've forgotten about it.
Mm-hmm.
The problem is I haven't forgotten.
Yeah.
So
Yep.
I'm still like,
Right.
Yeah.
So I've had to sort of teach myself to techniques for.
And that's
getting
hard
over
too,
it.
and giving yourself grace to like, it's okay that like if you're still angry about the situation too is important, because yeah, like you just flipped out on me and said really mean things and I'm supposed to just be okay. And then it's over. There was one time I had like Michael J. Fox and team came into the nursing home to like see, and so all of a sudden somebody came in and me and the resident were like, we were like a comedy act, right? And going back and forth, all of a sudden they said something really inappropriate to the person. And the person just like melted. And I was just like, oh my God, oh my God, oh my God. And then she just kept going, and became very aggressive about it. And we had to like leave the room. Right after, she's like, why did they leave? And I'm just like, are you kidding me? And like had to like sit down and like explain why they were so upset, right? But you oftentimes, if you're the person of that, like the fixation or focus of like that anger or aggression, like how do you sit there and say like, this is, so it's giving yourself that grace, because I feel like oftentimes caregivers or people in those kind of situations, you have to, it's always like, you have to do this, right? Like you have to modify or compromise, and a lot of things are changing in your life too. So it's,
I'll also say, to your point, a lot of times caregivers say that when patients go to appointments and they just are perfectly fine, but in the car, like you cussed me out to get here, you said you were trying to kill me, and they get in the doctor's office and they are like perfect, right? And sometimes I was like, I'm not lying about what she said. And we're like, oh, we know, like we're very aware of that. And sometimes caregivers, like families, get very cautious about that because they're like, I'm not making this up. So sometimes we tell people, like, write it down, like write down what time of the day, what triggers them to do that. And like calling the EMS or police in a situation, they know when they come, like, this is serious, let me get back, you know? So it is something in the brain. I don't know what it is, but we know they're still there, and certain things that arise make them, oh, this is a serious moment. I forgot what I just did. And it's very hard to be in your position to hold that, the good, the bad, and all of that. And I tell a lot of my families, especially the younger ones, sometimes, and it's hard when you're doing it every day, put yourself in their mindset. A lot of people are in their prime working years, family, and know that they should be doing a different course of life, but they're not. And that's number one, frustrating. And that's something that we will never be able to help with, right? Because this is an unfortunate disease, but we can help them through that process. So a lot of times people carry that. It's anger. I'm upset. Like, why me? So you're going to get lashed out. I'm going to fuss you out. And then, hey, I know you're here helping me, so I'm going to snap right back on in a minute, you know? And it's unfair, but it's reality. So sometimes I tell my families, it's hard to say that what you can take, because words do hurt, right? But that love and that connection is going to always be there. But just put yourself in that mindset. Like right now, they should be in their prime working years. They should be excelling, going on trips and all of this, but this is their reality. And it's very hard to remember that every time something happens. But at the end of the day, no matter how many times you got cussed out or blamed, just remember, I'm doing this out of love and they can't help it. If you have to just repeat that to yourself, I'm doing this out of love, even on the terrible days, because they can be. And some stuff we think, okay, you're doing this out of spite. Yeah, I
There's
don't know
no
about
way.
this.
Yeah.
You just kind of be, and that it could be a mixture of all. Nobody has like the right answer, and everybody is different. And we also have to look at what their personality was like prior to the diagnosis as well. So it's a lot to digest, and that's why I think like the caregiver crisis is major, because without the caregivers, then what?
And that other
Facilities
support
aren't really
isn't-
taking
yeah.
HD patients, so we require on the caregivers to do everything. So caregiver crisis is huge, and I loved earlier when they said, if somebody asks you to do something, let them help you. No matter how small it is, let them do it, because people want to help, but people don't want to overstep their limit. So then when you're in a crisis, hey, they said I can call them. I need you to come sit with the kids. I don't even have to explain what's going on to you. I just need you to come sit with the kids, and they'll be happy to do that. So it is kind of hard to build that trust and foundation, because some people have not even come to terms with the diagnosis, don't want people to know. There's so many layers of it. I've told one person, we can say, baby, you are subject to falls. We came up with whatever she wanted to use to be okay to tell her family. Didn't want to tell them it was HD. We can tell them whatever. They see that something's wrong. But if you prefer for us to say, hey, I have frequent falls, that's fine. People will meet you where you are. But that is a big thing too when it comes to crisis. A lot of people don't want to tell anybody.
Well, there's that recognition piece too. What's anosognosia?
Absolutely.
And for me, that's the hardest thing with
Yeah.
my wife is her brother was not that way at all. He
Right.
recognized he had the symptoms. He did what the doctor told him to do. He was on board with his own care. She's not so much.
Right.
She's passive aggressive about that.
Yeah.
And so it makes it harder.
Right.
And that's hard as like a loved one, like you don't want to point that stuff out, right?
Mm-hmm.
And then like, but it is so significant a lot.
And on to that, if you're asking somebody to come help,
Mm-hmm.
I really have to give them a brief about what help needs.
And sometimes people want to help and they just don't know how, right? And they're just like, like call me if you want me to like come and like sit or like whatever. It's like, you know what? Why don't you deliver groceries for me? Like give them actual items to like how they could actually help you. And just like, that would be great if you could run a few errands for me. Some people just don't know how to, and some people are scared. Some people like aren't living with it every day, right? And so, but that's on them. If they want to, like, if they're in your support network, like you need to be like, you need to show up for me then. Like, yes, I know this is hard for you too, but how do you think I feel? How do you think my wife feels or my loved one feels?
Can I take the situation one step farther?
Yeah. You can jump and I can jump in after.
So my advice is I would call APS, Adult Protective Services, in her area. You can start with them and let them know the situation, her disease. And I know it's going to be a lot of explaining because it's a rare disease, because they may come up on her and they may say, hey, she looks fine. You need to explain everything to them. You need to explain her symptoms. So I would start with APS. You can also do a wellness check where a local sheriff or someone would go out. And I mean that for paper trail, right? For paper trail that, hey, we've sent people out to check on her. She's unsafe, because you want to get APS involved so that maybe she will be appointed a guardian. And then that guardian will be over her. And even though she's not listening to you all, she'll become a ward of a state and they can help put her in a facility. So you said you did the guardianship. Did you do APS yet?
No.
Okay.
And the
would do-
reason, we said, like, it's really important for paper trail, right? Like to start there. But then when something does happen, it's like, see, this was something that is a behavior that's continuing, right? And it shows that you've tried to intervene as you could from far away. But also bringing APS, they have a little bit more intel of like being able to come in not like in a 911 situation and can like go into the home more and have conversations and fully understand and have more conversations with you.
And do you have
State or federal or local?
Local.
local?
Yeah. And then
do you all have her? I'm sorry, her like medical records or anything showing she has HD? Do you? Okay, because some people, if you're calling them, you need to tell them, I have this. She has this diagnosis. Is she going to any providers down there? That's your paper trail too, right? That's your and when I mean paper trail, he can help speak on your behalf or release medical records if you're available to for APS down there. So when you go through APS and you're just calling them, they need as much information as possible when they go out there so that they know the situation. And you can say, hey, if you need to be educated on this disease, I can give you my card, somebody from Duke, one of the social workers, so this is where the medical team comes in at. If a patient is involuntary committed or anything, a lot of people do not know what HD is. And you're gonna say, hey, my loved one has psychiatric symptoms, they need to be admitted. They'll send them home if they see them and nothing's wrong. But if you say, hey, this is their care team, they're gonna contact them and then they're gonna talk to them and see, hey, this is something. And that is so important with this because they're seeing them for a brief moment. So start with APS. It is for her safety. And because you're out of state, you're gonna need them to tap in.
and they can also do everything anonymously.
Yes.
They could also write like capacity and like where her baseline was, and then like also write letters of like when you're ready to use this, like you could put this into like she doesn't have capacity to make these decisions.
Right.
And that's where like the cognition like is usually not as impaired as like the behavioral or psychiatric, right? And like that doesn't come into play a lot of times with capacity when people are like emergency responses. They're just like, they understood what I said. It's like, there's more to that. But, and unfortunately, a lot of times, like something has to happen in order like for your loved one to seek, like get the care they need.
Right.
Which is,
Right.
yeah.
Right. Because what can happen can look a lot of different ways. So I would advise you to call APS anonymously.
Yeah.
Even on the phone, don't even tell them, just kind of get the basis in there first.
And you can absolutely, and I'll give you my card, you could absolutely say like, you can connect with this social worker that works for this national organization and, make it sound all great and I'm so fancy. And then I could educate them about this type of stuff.
And
Okay.
we do that though. And
That's
sometimes
my favorite thing to
it
do in the
has
world.
to be done, or they have so many cases, not saying they don't care, but they'll just say, oh, she looks fine, she's clean, and push it on. And that's not the case. So that's why we're here to like educate them and let them know like it can look one way, but it can be a different way.
They get a lot of calls every day.
Oh, they get a lot of
Going
calls.
triaging the
Right.
situation
Right.
and using their baseline.
Right. And it may not be serious.
What is their
to them.
baseline
So-
compared to, yeah.
And if it doesn't work the first time, that's fine. If she continues to do things, we can you call and do a wellness check. Like if she's calling you and she's having a episode, you can call and have them do a wellness check. Now, mobile crisis is one. I'm jumping.
Oh yeah,
all
I know.
like,
No,
to the
I know.
point.
I'm like, I don't know
But
where we are,
in,
but it's
in
fine.
and this is for everyone too, even though we're speaking directly to her. Calling mobile crisis is huge, right? because mobile crises are trained individuals who know how to deal with individuals with any type of psychiatric symptoms. So sometimes calling a mobile crisis unit before calling 911 is the best, because a lot of police are not aware of this disorder.
It's the same thing
So-
with the crisis response team.
Yeah.
Right.
Attendees.
Right. So Erica and I with HD Reach, we have lately been doing sessions with EMS workers, and we're trying to do law enforcement because of things like this. I don't want patients to call 911 for help and then somebody's going to jail. That's not what we're calling for. Like, I've been on the phone with the sheriff, picking someone up, taking them to the hospital, because I wanted to make sure you're taking this individual to the hospital and not to the police station. I mean, and it worked though, right? If not, they may have took that patient to jail because of what the patient was doing. So having people around like us to get calls to help, we will three-way. We can be on the phone with you talking to them if you need that. Like, that's no problem. It doesn't matter that she's in another state.
And there's like, and we know, like, because we've done this so much, and we know like what are certain like key trigger words for them, right? Like, it's like, what do they care about? Safety, you know, can they take care of themselves? Like, the things that might be important to us, right, might not be necessarily important to them in regards to like intervening in the situation. So that's where, like, you know what, I'm going to call this person as a third party person to like come and help with the situation. Like, happy to do
Yes.
that. And that's called something different in every, I don't know how it is in North Carolina, like different counties or different states. And
Peer
some of,
support specialist or crisis
Yes,
response.
I can help give you numbers for
who to,
mobile crisis. And so if she's in a crisis, call them before you call the police.
Well,
Let the
I wonder
police, huh?
Well, it's different for every single place that you live.
Yes.
Yeah.
The
Gotta
key
do-
here, I think, that is to figure out what
Yes.
little district or what space
Yes.
you're looking for.
So this is mainly
What
North
they-
Carolina
so
that
then
I
let
put
me
up
say,
here. But yes, it's definitely different in each state. But I would advise you to call them before calling the police, because they're just gonna go talk to her and say, hey, do you need help? She may not need help, but they're trained to kind of like calm a person, and then that's paper trail for you too.
But now, my uncle, my mother's uncle, back in before 73, he had Huntington's, didn't know what it was back then. And he finally ended up in VA hospital, but that was in Virginia. And the cops would beat him up.
Yeah.
They'd beat him up, lock him up because they thought he was drunk.
Mm-hmm.
And they like beating you up.
yeah.
So, you know, that's why I was asking earlier about.
But I encourage all of my patients to keep a card that says, I have Huntington's disease. So if you can't say anything or something on your phone, I need you to hold that up, okay?
Yeah.
They can read, or they can call somebody to read it, you know? So that is important, to have a card on you. It is very important. We also have things, yes.
Yeah, good.
We have things that can go, I think it's HDSA, that can go on the front of your house. Maybe it's Help for HD. And it's just a sticker there.
Yeah.
Yes, so if the police have to come to the house, they see this sign on the door, because you want your person to be safe, because they didn't ask for this. So I don't care what is going on at the moment. They don't deserve to be arrested or in trouble for something that they can't help. They need to be calm, they need to feel safe, and they need to feel protected.
And
So
in Durham County, you can do that, and I assume that you can do it pretty much everywhere now. But
Yes.
You can get up with your police and
yes,
with your fire stations, and they toggle you as like, I've got a kid at
Yep.
home that has autism. I've got
Yep.
some
Fire
here's
station-
I've got.
Yeah,
Fire
so like when
departments are the
911
best
calls,
ones.
it like comes up, right?
Yes.
Like when they're like, oh, you're where? What location?
Yep.
And that'll.
fire departments are the best ones. So whatever county you're in, call that local fire station, because when emergency, the fire department comes out first.
Yeah.
So they'll already know, it'll flag, hey, this person has dementia, or this person has this. It just takes a few minutes to get that set up, but I encourage anybody to do it. And then in the case of a fire or something serious, they know, hey, there's somebody here with that, break down, do whatever you got to do to get them out safe. So I do encourage anybody to call the local fire department in their town and get on that list. It's called something different in every town, but
Yeah.
it is like for certain
Would
disabilities.
you call the main fire department?
You can call the main fire department.
And, yeah.
And they'll
Across the
direct you
street from
to-
us, or would you call directly to the station? Probably
No, call the one up the street from you. The one that's gonna,
Yeah,
because if
that's
you
gonna
call the
come.
main one, they're gonna send it there.
Usually you can just get online and Google it too, and something will come up.
But if you go by there, they'll help you do it. And I think that's super important. Huh?
Yeah,
Some cookies
yeah.
or donuts.
You can bring that
Yeah.
too. You can
Bribe
bring
'em.
cookies or donuts, but
But
no,
then you
that
can give
is
them like
so
those
important.
documentations too, right?
Yeah.
Like, hey, if you don't have time to listen to me, read this or
Yeah.
listen to this, whatever.
And then there's also this thing online. I actually found it on Facebook, and it's called Tender Care. And so she has it in her wallet. And so, like, if she falls, what happens is the EMS will scan this right here, and it's connected to I have an Apple my phone, and so all of her information will come up. And so,
And it's
like,
free.
and it's free. And it's called
That's what-
Tender Care.
Gender care.
Uh-huh.
Is that just
Tender-
is that in
yes,
North
I meant
Carolina?
to put that on my thing.
I'm gonna write that down.
It
That's
comes
so
to
cool.
like the-
Can
so
you-
like,
Can you Google
she
it?
fell on
It's
Tuesday,
Tender
right? And I
Care.
was at work. The EMS scanned this. I saw it on my app where she fell, where they were taking her to the hospital
Tender
as they
Care.
were doing the triage. It kept me
Is this it?
advised of what was going on, but they were able to access,
Nuh-uh,
all
it's that
of
one
her,
down
all
there.
of her records.
Right there.
which,
Yeah.
I was like, oh,
from this card,
Yeah.
from this card.
That's the site right here.
Okay.
Right.
So it's
Tender
called
care.
trytendercare.com.
Yeah.
Thank you for that.
And you can do it with your mom in another state, honey. You can do it.
You
You,
can- I
put
was
her
gonna
stuff
say,
in
like-
there. Yeah. And it doesn't have to be HD. It can be anything. I have it on my mom because it doesn't matter.
So my oldest, she has kidney disease, so she has one. So she has one in her wallet, and so at home I have one on the refrigerator. So like, let's say I'm not home and she falls, and when the EMS get there, they can just scan it. I have one at church. She has this one in her wallet.
That's
and so all of her medications come up. Everything comes
Does that
up.
include advanced directives like
Everything.
AR and things?
Everything's on there.
Everything.
That's
comes up.
amazing.
And it's free.
And it's free.
Oh my gosh.
This
Yeah.
right here has
That is
And
great.
multiple family members can observe. So if you get it and then you want to observe too, it can be me and my sister both have it for my mom. So she told me about it. So it's wonderful. But yes, you can do that with your mom, and your mom doesn't have to know you're doing it.
right.
Okay. So I mean, it's not like you're doing something behind her back. You just for safety.
And
So
that's where
it's
like
okay.
that planning piece,
Yes.
like trying to catch things that fall through the crack as much as you possibly can, but there's going to be cracks that we can't catch.
Right.
Right. So, but at least trying to do like that's something that's easy that you could just do. I wanted to go do it for everybody in my family right now.
Right. Yeah.
Keep this up.
Yeah, it's good, and you just put the app on your phone, so that can
No charge.
no charge. If they do, I don't know what you signed up for.
Yeah.
But they did charge.
I wonder if
Yeah,
Yeah.
yeah, they did charge.
It's just about the internet.
and
No, and I understand, but yeah, they did have it's a magnet. You got the magnet, right? Yeah.
Magnet on the refrigerator
Yes,
at
yes.
home and the magnet on the refrigerator at church.
Yes.
And that's right. And that's one of the things that we like. I always say, I'm like, keep that information somewhere, like on the fridge or in the freezer or whatever, somewhere that it's not gonna. Because a lot of times, like when you call emergency services, they'll go to the fridge, right? Because there's usually like advanced directives there, or say like there's a binder on the kitchen table, whatever it might be. So if it's just a QR code, that's amazing.
I meant to put that on this paper too with our resources, but I forgot. But
No, that's
we pulled it
perfect.
up.
It's been a lifesaver because, like I said, as soon as EMS come, they scan it, and then it, like I said, goes directly to my phone, and I see when they pick her up. I see when she's in triage. I saw when she was doing the CT scan the other day. So you know what I'm saying? So even though I wasn't physically there with her, I was still able to keep up with her until I was able to
Get there.
to her.
Yeah.
Is that something that you can use just for kids too, for mental health crisis?
Yes,
Okay.
yes, it's
Real? You can do it under 18?
I'm curious.
No, so, yeah.
If that can be used for the mental health crisis right now, that would be.
who we serve maybe.
Yeah, it's,
Nanas. But on Nanas.
I think you can though.
I would, yeah, let's.
Okay, go up. You see that,
Oh.
sir? 100% always free. All right, that's what it said.
Verify.
That's what it said.
Secure.
There you go. I don't think it's an age.
Doesn't say. Usually that's something that they'd be like, yes, scanned.
Part of the reason I ask about the pay is, every business needs some sort of way to be funded. So
Right.
I wonder how they're funded and if
Yeah.
we can help them by, fundraising or something. Because it seems like a really good deal.
Yeah.
Yeah, the user interface is far too nice to not be getting money.
They have
Yeah,
to go.
they're getting
I was
money from
just
somewhere.
This isn't a
They're getting money from
state-funded
somewhere.
government.
Yeah.
It has something to do with data.
Yeah, but it's
Data is key.
good though, but
Right,
yeah,
it's
yeah,
got your numbers.
yeah,
Yeah,
yeah.
for sure somewhere.
But if it's to help save your loved one or know what's going on, it's
yeah.
kind of, yeah.
Yeah, absolutely.
Yeah. Did anybody else have any questions or specific things they wanted to?
Yes.
Yeah.
So I have HD, and my dad does, and my granddaddy did, and so on and so forth. And my kids may or may not, as we all know, they haven't tested yet, so we don't know. But I've actually had a harder time finding support for people with HD. And because it is so rare that there's not a ton of support specifically for the people, and the support that's out there is usually geared specifically for a caregiving mentality, which is great, and you can learn so much. And I'm always going to be able to get something out of that anyways because of looking at my father and like the rest of my family, and so I can get something out of it. But when it comes to like wanting to be a little selfish and have something in that space, I'm not finding very much that's geared specifically towards that. And I am not a sit down and chill out with a therapist kind of girl. I am like a let's have those cigarettes and whiskey and this little kind of girl. So I've had a hard time finding any kind of help and that I feel comfortable with.
Yeah. And so I know for me, we do have like support groups, and they're not just dedicated for caregivers, right? And they're for people that are, HD positive symptoms, HD positive pre-symptomatic, HD at risk, whoever you are in the community, there's a support group for you out there. There's also different conferences and like different educational like things like this that are around, that are all around, and a lot of times there's like free funding to get you there. But that has a lot of people that are in your same situation. That is just like that, drinking that whiskey after all the education.
Have to happen for that.
Right.
Totally.
No, for sure. I get it. Yeah. But no, it's just like, this is the common denominator between us, and like we don't have to explain anything, and finding that community, but also finding that like education for like, I'm not here listening, like we're talking about being a caregiver. And I'm just like, you're like, I'm here because I want to like figure this out and like plan for my loved ones for the future, or my dad, right? So
I will say Help for HD does a lot. Well, they'll pay for you to come out, room and board. They do a lot of activities. They have a table here, but I'll make sure go by their table in HDSA. HD Reach does have a monthly support group. They meet at breweries.
Yeah, I just heard about and they're like literally a spin
Down the road from you. Okay.
They meet at the place where we play darts.
Okay, so there you go.
Yeah.
amazing.
That's somebody close. But yeah, Help for HD, they have big events, and if you're someone diagnosed, they'll compensate you, get you there, and all of that. So yeah, start with HD Reach because it's local down the road from you. But like she said,
I'm excited to know about them.
oh yeah, absolutely.
And a lot of this stuff today could be like really overwhelming. Like there's a lot of things, right?
Yes,
Like
yes.
I'm like, take my card, call me
Right.
tomorrow.
Right.
Like I can't wait to talk to everybody. But like it's okay if you just keep it for when you're ready.
Yeah,
Right?
yeah.
Like you don't have to make that.
So definitely go by their table and
I
pick
have.
up. Okay,
Yeah.
Help for
I was
HD,
just-
yes.
Yeah, like
Yes.
this is all the new things.
Yes.
But, like if you know it more.
Yes,
then
yes,
Writing it down.
yes.
And like I said, I'll give you my card, and I can send you a little, like I have like already template emails like set up for like, here's what you might need in a few weeks, in a few months, in a few years.
That's awesome.
Did anybody else have any questions? Everybody feel okay? You didn't learn about tender care. If you
Yeah.
didn't learn anything else
And that's
today,
really, I
you
learned about
the
this.
free tender care.
Yeah,
app.
thank you.
Yeah, that's huge.
Yeah.
Yeah.
Well, thank you guys for joining us, and we're always available. I'm throwing both of us
Yeah,
up, always
yeah.
available. for anything, honestly.
Absolutely.
Yeah.
Thank you all.
Thank you.
So before you go to your next session, I know they have snacks, coffee, and drinks in the middle, but everybody give yourself grace and
Yes.
thank you all for being here today on a Saturday.
Yeah. Thank you. Thank you.